The purpose of this video is to help you identify where you are along the healing process for your low back pain. So what we're going to do is we're going to walk through the timeline, what's going on, what you might be feeling, and then follow that up with some direction as to what you should be doing to provide that you keep moving in that right direction, because we don't want to turn back at all. So we're going to talk about part 3 today, and this is after the pain leaves for the most part. Again, this is going to be very variable when this occurs, because it's going to depend on your metabolic health. It's going to depend on how many times you've had this. It's going to be dependent on whether or not you're creating a healing environment for your back. And really these first couple weeks here. This will take anywhere from 2 to 3 weeks to get to, provided all that other information I just gave you. But really what's going on when you start to feel less pain, maybe you feel a little bit of stiffness in the morning, but that's it, or a little bit of stiffness throughout the day, that's telling us that the inflammation is by and large gone. The tissue is at least 50% healed, and overall you're doing really good. Now, for the active population, this is where we get into trouble, because healing is happening, but the tissues are still vulnerable, which gives you this false sense of security. You go to, oh, I feel like I did before this happened, well, let me go back to what I was doing beforehand, and really your body is not ready for that yet. We want to make sure that you're out of pain for at least 2 weeks before you start to return to your fitness or other heavy physical activities. So we will give you stuff to do in the meantime, don't worry. All right, as far as treatment is concerned, while you might be feeling pain-free at this point, tests will determine discharge, right? Those tests are determining your dysfunction. If we leave any dysfunction on the table, this will come back around again to bite you. So while you are feeling good, we want to maximize what we can do in the treatment room to prevent this from coming back around again or having this degrade further. Right? We will start to engage in some strength and some movement rehabilitation at this point with very low load on your back. But again, we're not going to get all heavy into the gym until we're 2 weeks pain-free. So if that's what you're feeling, these are the things you got to do. Let's just keep going with your progress, and we'll get you back in the gym soon.